Dr. Boyd Franklin is a distinguished professor emerita at the Rutgers University. Dr. Boyd Franklin has published multiple books and numerous other writings. One of her books, Black Families in Therapy, was really a landmark book that pretty much changed how family therapists thought about Black families. It really oriented family therapists toward thinking about culture and what it may mean, and to be more critical in thinking about particular theories and how they apply when working with Black families. So with that, I don't want to take up much time from Dr. Boyd Franklin. I am very happy to say that she is one of my role models, and I'm sure a role model for many others in the field of family therapy. So with that, I present Dr. Boyd Franklin.
Thank you, Marlene. Can everyone hear me okay? Good. I just want to thank Marlene for inviting me to do this lecture. I'm very excited about it. And folks, Shauna is an extremely important person in this process. Those of you who are closer to our age know that technology is a challenge. So Shauna, thank you again for being on board. We really appreciate all that you've done. So welcome everyone. Tonight, I'm going to be discussing racial trauma in therapy with African-American clients and families. And couple of disclaimers first. Time is so short. I know it seems long now, but this time is going to fly. Therefore, this presentation will focus on clients and families who identify as African-American. Please do not assume that all of your Black clients are African-American, even if they're second or third generation. Many are still very connected to their original cultures. There is tremendous diversity within the Black community in response to issues of racism. And so one of the things I really recommend to therapists of all backgrounds is that, first of all, that you take the time to do, as Harry Aponte told you all last month, to join with clients, to use yourselves, to connect and help people feel comfortable in therapy, but also to ask about your clients' families, where they are, what their cultural and racial experiences were growing up, and how they identify racially and culturally. Please do not assume that the issues discussed in this presentation will necessarily apply to all Black clients, including recent immigrants from countries like Haiti, many countries in the Caribbean, countries all over Africa, and other countries throughout the world. Ask these clients about their own cultural and racial experiences since they have come to this country and what challenges they have faced. Many have faced tremendous challenges in this country. Now, in terms of racial terms, a couple of disclaimers. Many of the terms used in this presentation are academic terms. It is very rare for Black people to come into therapy and ask for help with racial trauma. They report depression, anger, rage, fear, anxiety, and many other feelings. But there are two exceptions to this rule. There are two main groups of clients that may come into your office talking about racial trauma. First, Black and other people of color who are in our training programs in the mental health professions, who have learned these terms. And don't discount the second group of persons of color who have been deeply committed to social justice work and are therefore familiar with these terms now in recent years are all over the internet and social media. So I want to give you just an overview of what I'm going to try to cover tonight. I'm going to start with definition of racial trauma and race-based traumatic stress, a concept that Robert Carter introduced to many of us. I'll talk a little about the different types of racism: individual, cultural, and systemic. I'm definitely going to talk about vicarious racial trauma and the impact we've all experienced of stories, videos, social media, and the news, particularly showing attacks and killings of Black people. We're going to talk about the anger and fears of African-American clients and their families. And one of the things that I'd like to cover is the issue of racial socialization. The media has been fixated on the talk, but the truth is that there are many talks that Black parents and families give to their children, particularly African Americans, throughout their lives about the issue of racism and racial trauma. So we'll talk about addressing race, racism, and racial trauma in therapy, whether you are Black, white, Asian, Latinx, or from other cultures. I want to give you some parameters to think about in terms of raising these issues. But I also want you to have the opportunity to think about utilizing cultural strengths of Black people in therapy for resilience and healing. And I will include suggestions for therapists of all backgrounds throughout this presentation. So let's go, buckle your seatbelts. But I want to start with racial trauma or race-based traumatic stress. Racial trauma or race-based traumatic stress refers to the impact and cumulative effect of experience of racism, all types of experiences of racism against Black people on an individual African American's mental and physical health. These include experiences of danger, threats of harm or injury, but also they can include the cumulative effects of humiliating and shaming events, repeated racial microaggressions. I'll tell you more about those in a minute, and witnessing harm to other Black people through racial incidents. This may also include vicarious racial trauma through the repeated viewing of shootings, killings, or brutality of all kinds toward members of one's racial group in person, on television, or on social media. By the way, just to bring it to your attention, below is a citation for one of Lilian Comas Diaz's articles in 2019, published in The American Psychologist, which looks at racial trauma on many different groups of persons of color. Now, some of the leaders in this area of racial trauma and race-based traumatic stress have been, of course, Janet Helms and Robert Carter. And they have argued for training in racial trauma for all therapists for many, many years. But here's the catch. As Janet Helms has indicated, racial trauma is ongoing and cumulative. And as you'll hear me say many times, it's linked to experiences of anxiety, depression, suicidality, intense anger or rage, and fear, and sometimes flashbacks, nightmares, or sleep disturbances that we associate with PTSD. Many clinicians trained to treat trauma patients have no idea how deeply racial trauma is experienced by many of their Black clients. So racial trauma may result from direct, cataclysmic racial or cultural events, including life-threatening murderous assaults, like the killing of George Floyd. These may involve death or threatened death or injury to a person of color or a significant person in your client's life. Now, vicarious cataclysmic events, such as the murder of George Floyd, sadly are occurring more and more frequently, partly because of the introduction of cell phones. These cataclysmic events were always talked about in the Black community, in Black newspapers, on Black media. I heard them growing up, but now the whole world sees and hears them. The third area is racial and cultural microaggressions that are discriminatory events that trigger memories for many African Americans of past personal or historical group trauma. And often that can be very threatening to a person's mental health. And what's interesting is that, as Daryl Wing Sue has indicated, these may be everyday racial events, sadly. Now, Janet Helms has argued that these may contribute to PTSD for Black individuals. But I want to make some distinctions. The trauma literature has overlooked racial trauma. And therefore, in some cases, you may have Black clients who have a form of PTSD related to cataclysmic racial events in which they have seen or experienced racial trauma directly, or against themselves or against a loved one. However, diagnostic categories for PTSD may be too narrow and not include other forms of racial trauma. For example, racial trauma, as I've said a couple times now, may be vicarious and may result from seeing these traumatic experiences on social media or on the news, not just killings or shootings or murders, but violence against Black people and other forms of racism. Now, in other cases, racial trauma may be cumulative and result from many experiences of racism, microaggressions, discrimination, and oppression. Now, I want to teach you a few other terms. I know for many of you, these are very familiar, but I just want to review them quickly for those who are new to them. One of the issues in this whole process is that biases, particularly racial biases, can be unconscious or implicit. And as James Jones, one of my heroes who has written some of the most important books on racism. By the way, just an aside, I have included an extensive reference list at the end of your PowerPoints that were sent to you. So please take a look at some of these books. But implicit or unconscious biases are learned attitudes or stereotypes that are unconscious thoughts, feelings, or beliefs about members of another race that can be automatically activated and unconsciously attributed to a person or group of people. They affect how we understand and interact with persons from other groups. And it's important because all of us have unconscious biases. Therefore, it is important for all of us to examine our own unconscious biases. And some of these biases may be unintended. And here's the catch, they can be easily denied. So you often have Black clients saying, am I crazy? I experienced this. And folks denied that it even happened or that it was intended to be hurtful. But they can still, these unconscious biases can still be very hurtful to a person of color. Now, the other term that is so important in this is that of racial microaggressions. And that can certainly contribute to racial trauma. Many of you know Daryl Wing Sue at TC at Columbia, who has written extensively on microaggressions. And according to Sue, racial microaggressions are verbal or behavioral indignities, whether they are intentional or unintentional, that communicate hostile, derogatory, or negative racial slights and insults toward people of color. Now, as I mentioned earlier, these occur in everyday life. Let me give you an example. And I want you to think about the effect that this might have had I been a younger version of myself. This example occurred when I first taught my first class at Rutgers. As Marlene mentioned, I am an emerita now. I retired in July. But in my first class, my first diversity class, I asked all of my students to write journals. And I didn't read them until I got home that night. So I'm reading along, and I come to the journal of a young white man in which he had said, I was really surprised to see that you're such a good teacher and lecturer. When I first heard that you had been hired, I thought you were an affirmative action hire. Well, let me put it this way. The reason the young man is still alive today is because I'm married to a wonderful therapist and psychologist, Dr. A.J. Franklin, who peeled me off the ceiling and helped talk to me about the importance of finding teachable moments. To be honest, that night I was not feeling much like a teachable moment. But when I sat down and talked to this young man, he was stunned. He said, I was trying to compliment you. I had no idea that this would be offensive. Now, these kinds of issues, though, can contribute to the cumulative effects of racial trauma, and they may be denied or minimized by others when they are reported. And I came away from it feeling he didn't mean no harm, but he was ignorant about these aspects in the lives of Black people. And closely related to this, now, many of you know the work of Peggy McIntosh. Peggy is a white feminist scholar who has taught extensively and written extensively on white privilege. And as I was preparing for this talk, it occurred to me that it clearly was an act of white privilege that this young graduate student thought he could write that to a full professor with tenure, all right? That is an example, sadly, of white privilege. But imagine what it might be like for a young, new teacher or professor trying to convey important thoughts. So often, our Black and brown sisters and brothers receive terrible evaluations when they teach in our programs. Peggy has said, I'm going to quote her because this is an interesting quote. I was taught to recognize racism only in individual acts of meanness by members of my group, never in invisible systems conferring unsought privilege and racial dominance on my group from birth. And she was clear. She had written extensively about male privilege, and some of her sisters of color had challenged her on white privilege. And Peggy McIntosh, to her credit, stepped up. She gives a couple of examples. I can go shopping alone, pretty well assured that I will not be followed or harassed. She said she could be pretty sure that I will not be stopped by the police when driving because of the color of her skin. But, as I was preparing tapes for this presentation, it occurred to me that one other aspect of white privilege is not having to experience racism or racial trauma, or even worse, having to prepare your children or adolescents through racial socialization in order to protect them from the negative effects of racism. Now, one aspect of Peggy McIntosh's work that I think we can all take away is the notion of using white privilege to advocate for others. And this is really something that we've seen in the social justice efforts of the younger generation. I am so impressed with them. Now, another giant in this area of racial trauma is, of course, Dr. Ken Hardy. Before I tell you about his work, I just want to mention that thanks again to Marlene Watson. He will be doing a virtual webinar just like this as part of the Ackerman Distinguished Family Therapist Series on December 10th. So please put it on your calendar and go online and register. He'll be talking about a different topic that is very powerful. But Ken has written about the hidden wounds of racial trauma. And he has called them, and I think this is so powerful, he's called them soul wounds. And he's talked about the fact that racism and racial oppression is a traumatic form of interpersonal violence. Now, notice this, that can lacerate the spirit, sear the soul, and puncture the psyche of Black people and other people of color. So this leads to things like internalized devaluation, an assaulted sense of self and assaults against one's self-esteem, internalized fear, voicelessness, and hopelessness, and very importantly, the wound of extreme anger or rage. Now, Ken has talked about the important aspects of healing the hidden wounds of racism and racial trauma in therapy. And he's talked about the importance of affirmation and acknowledgement. And I'll give you many examples of that. Sometimes clinicians get on a roll with asking questions. It's very important to slow down and take the time to affirm and acknowledge what our clients are telling us. He's encouraged people to create space for conversations about race. And he's really become a master at helping clinicians learn how to use racial storytelling. For example, asking clients, was there a time when you were treated differently because of your race? And he talks over and over again about the importance of validation. The process of naming the wounds of racial trauma. As I indicated early, racial trauma is a relatively new term. And so many African Americans may not have even heard it. And so labeling what they went through as racial trauma and helping them to see that it was serious can be very important. People feel validated. He's also talked about helping clients to externalize devaluation and recognize assaults on their dignity and self-worth, which do not reflect them or who they really are. And he's talked about counteracting that devaluation and finding other ways to gain respect. Because rage is an outcome of some of it, rage goes beyond anger, folks. Rage is serious, repeated experiences with anger. But he talks about channeling rage and expressing it and giving voice to the anger and rage that they feel. Some of my Black colleagues will relate to the fact that some of my best writing occurs when I am in a rage about some of what has gone on in this country. The other very important term, and it's very important for African Americans in this country, is multi-generational racial trauma. Some people call it intergenerational. But there has been a great deal of work on this. Dr. Ken Hardy has produced a video called The Psychological Residuals of Slavery. Racial trauma is not new for African Americans. It's been going on for 400 years and has affected the psyche of Black people. It's affected the soul of Black people, as Ken pointed out in a wonderful presentation at Rutgers last week on racial trauma. Dr. Joy Degree has written about post-traumatic slave syndrome and talked about how some of those soul wounds still remain with Black people, particularly African Americans today. Black families, African American families share the history of race in this country with their children and with other family members. They also share the racial trauma of family and extended family members that can affect younger people in the family. But here's the catch. Hearing the stories of racism and racial trauma of parents, grandparents, and ancestors is so important for one's racial identity and for preparing one not to take racism personally. But it can lead to multi-generational racial trauma. Now, I've mentioned the term 3 or 4 times, but I want to go a little deeper into vicarious racial trauma. Vicarious racial trauma, as I said, has always existed for African Americans in this country. But as I pointed out, the addition of cell phone videos has made these experiences even more vivid and painful. Vicarious experiences of the death of a Black man or woman, such as the murder of George Floyd in 2020, can eat away at the soul of Black people. Racial trauma can be experienced vicariously after the killing of other African Americans or other racist incidents. Racial identification with the deceased and his or her family is very, very common. Remember, African American and most Black cultures are collectivistic cultures. I am because we are. I hurt because you hurt one of my own. Increased experiences of mental health symptoms, such as many of the ones we've talked about so far, increased anxiety, fear for family members, depression, sadness, mourning, anger, rage, and even suicidal ideation. Now, I'm going to tell you in a few minutes about the work of Barr and his colleagues who are in the public health field and at some of the major universities in this country, and some very important research that they have done. But before I do that, I want to share with you some of these responses to vicarious racial trauma. Now, anger and rage, not just about individual or cultural racism, but about systemic or institutional racism and the lack of fairness in so many situations. Increased fear of victimization and greater mortality expectations and fears for our children, for our adolescents. You'll hear more, our young adults, you'll hear more about that a little bit later. But many of you know from reading my work, particularly my first book, Black Families in Therapy, and the second edition of that book, that this has led to increased vigilance and often healthy cultural suspicion and diminished trust in social institutions, including our clinics, our hospitals, our schools. And so even if you are Black and working in these institutions, clients of color and particularly African American clients may approach you with healthy cultural suspicion. It can often lead to lower self-esteem, sadness, grief, depression, hopelessness, and of course, rage. But also, it's important to remember that current experiences can activate prior histories or prior experiences of racial trauma. And as Bohr and his colleagues found in their research, there is almost collective bereavement in Black communities. Now, I want to show you a brief video of the response of a number of African Americans, adults, children, adolescents after the murder of George Floyd, and many of whom demonstrated in Black Lives Matter demonstrations. But as you watch, I want you to imagine that as these individuals are speaking, that they are actually clients sitting in your office and expressing very powerfully these feelings.
We shouldn't be fighting the same war that our grandmothers had to fight, our great-grandmothers had to fight.
Nothing has changed. What are we supposed to do? Nothing has changed.
You can't sleep at night until you know that they're home in the house, because you never know.
I am afraid because, like, if I go outside, then something will happen to me or my family.
You cannot insulate them, because at some point, they're going to come face to face with the reality of their Blackness.
This is a time that this generation just really is saying, no, I'm tired of it.
We have to stand united. Don't you all give up.
When you watch your big brother, who you looked up to your whole entire life, die begging for his mom, I'm tired. I'm tired of pain. This is 2020. Enough is enough.
That's the brother of George Floyd. And I want you to imagine, as I said, that any of these clients are sitting in your office, worked up, angry, fearful, despondent, feeling hopeless. And I'm going to talk throughout this presentation about discussing racial trauma in therapy. But I wanted to underscore something, and that is that it is very important to use your reflective listening, validation, and acknowledgement skills, rather than just jumping into tons of questions. It is not the job of our clients to teach us about these issues. We need to learn more and study more and listen more. Reflective listening might include something like watching the murder of George Floyd on TV was obviously an incredibly powerful experience of racial trauma for you. And it has increased your fear for your children. Can you tell me more about these feelings that it stirred up? And it's very important to be silent, to give your client time to respond. You want to validate her or his feelings, acknowledge them. Clients may give you stories of multi-generational trauma, experiences I had in my own family of my parents telling me about things that they went through, things that my grandparents went through, things that my ancestors went through. And so the next area on this slide is the multi-generational racial trauma. And you might respond, you also spoke about your father's pain and his experiences of racism. What was it like for you to hear those stories? What did you feel? We have to first let clients know that we hear them. The last example on this slide is in response to a microaggression a client might have experienced. So you were the only Black person in that class, and that teacher made insulting comments about Black people. How did you feel at that moment? And then waiting for that client to respond. That waiting is hard to do sometimes. Now, I'm going to come back to this issue, but I wanted to spend just a few moments on the topic of raising the issue of your race in cross-cultural or cross-racial therapy. If a client has shared something powerful and emotional and an experience of racial trauma, you want to validate that. And you want to ask how it feels for them to share it with you. So you just shared some very powerful and painful experiences and feelings with me about your own racial trauma. Your words touched me deeply. How did it feel for you to share them with me, a white or Asian, Hispanic or Latina, Latinx, or other therapists? And then be silent for a little while and let your client respond or not. If you're running out of time in the session, process your client's feelings first. You can bring up issues of your race or cultural background in the next session or in a future session. It is most important to take the time to first deal with their own responses, their own feelings, their own issues, and let them know that you heard them by reflective listening. If you do come back to it at a later point, next session or whatever, you might say, you have been in my thoughts all week. You shared some very powerful and painful feelings about your own racial trauma with me in our last session. How did it feel for you to share those feelings with me, a white or Asian or Latinx or other therapists. And frankly, it's very important for Black therapists to ask, how did it feel for you to share these painful experiences with me? I will definitely come back to these issues later in the presentation and go into them in more detail. But I thought it was important to introduce this now. We'll come right back to that slide later. But first, I want to talk a little about the different types of racism. The first is an individual or in-your-face kind of racism, behavior that directly discriminates or causes harm to an individual belonging to a particular racial group. But the second is cultural racism. Now, if you read any of James Jones' work, he talks about these different types of racism, and I recommend strongly that you look at both of those books. But the second kind, cultural racism, is involved in the prejudices, discrimination based on negative beliefs about persons of another race and the belief that some cultures are superior or inferior to others. Very important to know about, because often this is an unconscious bias. But then there's systemic or institutional racism. Institutional, systemic, or organizational practices within American society that reflect and produce racial inequalities or disparities, whether they are intentional or unintentional, overt or covert. Now, I've included on your slide examples of how those are illustrated in George Floyd's case and in that experience. But in the interest of time, I'm going to move us a little forward because I want to tell you about Bohr and his colleagues who in 2018 published an incredible study entitled Police Killings and Their Spillover Effects on the Mental Health of African Americans, a population-based quasi-experimental study. And they had a large national sample of African Americans who were exposed to a police killing of an unarmed Black American in their state of residence in the 3 months prior to this survey. Now, you need to know that more than 300 Black Americans are killed by police each year. And killings by police of unarmed Black Americans had significant adverse effects on the mental health of African Americans in that state, quite frankly, or those from other parts of the country, particularly in the first 1 to 2 months after that killing. Now, it's important to understand the bigger picture. As I said, more than 300 Black Americans are killed by police each year. Black Americans are 3 times more likely to be killed by police than whites. And Black Americans are 5 times more likely to be killed when they are unarmed. And adding to that trauma, in some cases, it is rare for police officers to be arrested or prosecuted. And it's very rare for police officers to be sent to prison for killing African Americans. These experiences can be re-traumatizing for African Americans. For example, when the police officer was not charged in Breonna Taylor's death, that re-triggers the initial trauma. Now, you've all heard the terms Black Lives Matter and Say My Name. I want to underscore for you that for African Americans, the numbers are adding up. And Black people do not forget that both George Floyd in 2020 and Eric Gardner in 2014 were killed by police in a chokehold saying, "I can't breathe." If we look a little further down, Breonna Taylor at age 26, killed by police in her own home. But the one that really puts the fear of death in the lives of many Black parents and grandparents, you'll hear it talked about over and over, is Tamir Rice in 2014. Tamir was only 12 years old. He was killed by police in front of a playground, running around with a toy water gun. Or Ahmaud Arbery, many of you have heard on the news, that trial is going on now as we speak. The man was 25 years old, jogging near his home in Atlanta, and he was killed by white vigilantes. Scary stuff. But the one that remains endlessly in the lives of so many parents and grandparents, African American, is Trayvon Martin. Trayvon was 17 years old. He was walking home from the store in his father's home community in Florida. And he was killed not by the police, but by George Zimmerman, a white man, another vigilante. And to this day, the image of Trayvon in his hoodie, carrying a bag of Skittles, stays in the minds of Black people, particularly parents and grandparents. But these experiences of racial trauma lead to fears of African American families for their children, particularly their sons. Therapists and counselors must understand these issues and be able to address them as a part of culturally competent treatment with Black adults, children, adolescents, or families. Any racial incident, particularly the killing of an African American or another Black person, can traumatize your client. And this may lead to many of the emotions we've talked about earlier. But it also leads to fears for themselves and other family members. Fears for sons and daughters, quite frankly, but particularly for male children and Black adults, particularly men. Many of you know about Driving While Black, DWB. The sad thing, though, is what about Jogging While Black, Ahmaud Arbery, or walking home in a hoodie like Trayvon Martin? It seems like these issues don't go away. So fears for Black men and boys are very common in Black families. Many of you who work with African American mothers of all class backgrounds will tell you that they worry for their sons, particularly when they are first born and they are facing a life of worry. African American families are prayed for all family members, women, girls, men, boys. Black women are also victims of homicide by police, witness Breonna Taylor. But historically, however, Black men and boys are killed at significantly higher rates. One of the cultural forms of racism is the stereotypes about fears of Black men that lead to excessive force by police, or the killing of a kid who isn't even armed, who's walking or jogging in his own community. DWB may come from racial profiling and tends to focus more directly on Black men, although you'll see in a little while a video of a Black woman experiencing this, but it leads to heightened fears for our children, particularly our male children. Now, one of the aspects and one of the strengths of African-American culture is the racial socialization that we provide as a strength and a buffer against racism and racial trauma for our children and all of our family members. We teach children about Black history and African-American culture. Howard Stevenson, I've included a number of his articles in my reference list, but he has done an amazing job and a lifetime of research on racial socialization. It's very important. Many families do cultural genograms, family trees with their own family members, and teach their children about others who have gone ancestors in the family. Discussions about racism and developing a positive Black racial identity is very important so that kids don't take racism personally when it occurs. And this occurs from early childhood to late adolescence, right into young adulthood. Many Black families read books with kids from an early age about race or about the giants among our ancestors, Martin Luther King Jr., Malcolm X. But it's very important to help families adjust discussions about race or racism to a child's developmental age. And another aspect that I talk about in all of my books is to many Black families are discovering that they need to make sure that their children, their African-American children, have the opportunity to meet other Black children, particularly if they are living in predominantly white areas. In 2000, my husband, AJ, and I wrote a book called Boys into Men, Raising Our African-American Teenage Sons. And we went into this in great detail. There's also a large discussion on this in my book, Black Families in Therapy, the second edition, Understanding the African-American Experience. But the talks about race and racism happened from a very early age in Black families. And the media has picked up on this term, the talk. But in most Black families, particularly African-Americans, it's not a one-time event. And it occurs throughout childhood and adolescence. The goal is empowerment as well as caution, hope as well as reality, belief in oneself in the face of racism. These are the strengths of Black families. And the talk is not about scaring them, it's about preparing them for racism so they don't internalize it and take it personally. Now, often it occurs after an upsetting racial incident in a child's life, or after the killing by police of others. With preteens and teenagers, you can be increasingly more frank. The media has picked up on one aspect of the talk, which is what to do if you're stopped by the police. But quite frankly, that's only one aspect. African-Americans are about building resilience and empowerment messages into their talks with their children. Parents and family members let children know that they are loved, they are special, they are smart, handsome, and beautiful, and they can and will succeed despite racism. You'll see this in a moment. I'm going to play something for you. Parents and family members love them and will be there for them throughout their lives. And that they can always come to us and talk to their parents or family members about anything that is on their minds. This is hugely important. You know, we talk about vaccines for the virus, COVID, Well, folks, there is a racism pandemic in this country, and this helps inoculate Black children against the realities of racism. Now, the talk that the media is fixated on, what to do if you are stopped by the police. In our latest book, Boyd Franklin and Bree in 2019, there's a whole section on the talk. And so I hope you will go back and look at this. But there are a number of things, just quickly, that Black parents say to their children. Do not try to run away. Keep your hands in the air. Say, I am not harmed. I have nothing that can hurt you. Do not make any sudden moves. Ask permission before you reach in your pocket for your ID. Do not act smart or talk back. Do what they tell you to do. Do not resist arrest or resist being searched. As soon as possible, drop that dime, ask to make the phone call to your parents or family for help. Ask for a lawyer to be present before you say anything. Now, I want to take a moment just to share with you some videos about this. And I want to emphasize that the talk may be a very difficult experience for Black parents and children or adolescents. And remember, these are many talks throughout a lifetime about race, about racism. And they can often be difficult and painful. Sometimes parents are so scared they almost sound angry. Sometimes parents will, as you'll see on one of the videos later, will express their grief in tears. But many Black parents feel intense anger about rage about racism, and intense fear for their children and grandchildren. Many fear that it's unfair that families must have the talk about racism and what to do if you're stopped by the police when white families do not. Folks, this is the ultimate example of white privilege. The talk can be incorporated into family therapy sessions. If possible, though, I would strongly recommend it's important to give Black parents or grandparents an opportunity to process their own feelings in therapy before they have that talk with their children or adolescents. At home, they often don't get that opportunity. They have to launch into the talk because something has happened. And encourage parents to take a breath and ask their children or adolescents questions throughout and see what they are feeling or experiencing. You'll see that in a few minutes. This is a very powerful video that I want to show you. It's called Dear Child, and it was made by a videographer who interviewed African-American parents and adults and asked them to have the talk on camera for the benefit of other families.
Dear child.
Dear child.
Dear child.
The reason we have to have this talk is because you are a Black child in America.
I need you to know that, man, there's so many things going on in the world.
I won't lie to you, you're going to see some things that are going to break you down. It's going to hurt.
I know how hard it is for you to see yourself in the place of Tamir Rice.
So I need you to always be prepared and always be on your guard. And it takes away from you being a little kid, I know. But I'm trying to protect you right now.
If you are approached by police,
Just stay calm.
Don't fight back. Don't give any rebuttals. You have to understand, if you want to stay alive, you have to do what they say.
Because it could be the difference between me seeing you again and not seeing you again.
Sad to say, sometimes it may not even work. I'm just gonna be honest. It may not work at all. I'm sorry.
I know it's tough.
And I know it sounds really scary.
But it's not your fault.
We live in a society that is geared that we do not succeed. It is put together, it is constructed in such a way that we fail. And you have to be greater than all of that.
Always stand with your head up and your shoulders back and be proud, and you are a warrior.
Always know that you are intelligent, beautiful, bright, and you have a future.
You have inherent worth in this society.
And above all else, you're my son.
Regardless of what happens, because I don't know what's going to happen today, tomorrow, whatever. Just don't change. Don't change and be proud of who you are.
I love you with all that I am. I will teach you how to walk in this life. You don't have anything to be afraid of.
We'll get through this, and don't you ever, ever, ever blame yourself for what others do.
I love you. I believe in you. And I believe that others, just like you, who hold on to their light, together, you all will change the world.
Powerful stuff. But Black parents, particularly African Americans, have been having these talks with our children for 400 years. And the talk is a challenge. You have to walk a fine line between helping them to know what may happen and not making them bitter or negative or doubting themselves. Now, in counseling or therapy, Black adult clients in individual therapy may ask how to talk to their kids about racism when something like George Floyd happens. Families that you're seeing may ask your help. You may need to discuss this in an individual or group therapy with Black adolescents. Talking to Black teens about what to do if you're stopped by the police is very interesting. You first have to get past all the bravado and all the macho and really talk about what kids, what they would have to do to stay safe. One thing that's important, do not usurp a parent's role. Involve family members in the process if possible. Have an individual session with the parents first so they can talk about their fears, their anger, their rage, and then have an opportunity to talk to their children. Be prepared for strong emotions, anger, and fear, often expressed through tears. Remember, you may encounter Black folks who've never had the talk themselves and for whom this is brand new. This was another attempt by their videographer to interview Black parents and their children about the talk.
I'm Brianna. This is my mother. Hi, I'm Roshonda.
Are you comfortable just telling her directly how you feel she should act around police?
Oh, see, now I'm getting emotional. Why are you getting emotional, Mom?
Are you worried about me?
I would hate for anything to happen to you. There's a lot going on in the world. And there's a lot of bad police officers.
I know.
There's good police officers. There's good police officers. And my fear is that you run across one of those bad ones. If you run across a police officer, please do everything that you're supposed to do and everything that he requests. If he tells you to stop, stop. If he tells you to be quiet, be quiet. Do everything that you can to get back to me. And also remember, though, there's good cops out there too, Brianna. So don't always assume that all of them are bad.
But all you see on the news and in newspapers, and people say that all of them are bad, but they're trying to protect us.
Right. And they assume that you're bad. They assume that you've just robbed a bank. They assume that the worst of you, but don't always think that they're all bad. They're not all bad. Don't be scared to call them or get help from them.
I'm not afraid to ask them for help.
But if anybody, any officer comes up to you, baby, please put your hands up. Just follow instructions. I was driving to work. I had my hood on because it was cold, and I was pulled over by a police officer.
It was the black hood, right?
I don't remember. It was a hoodie. And he pulled me over, and I was so scared. And I asked him, I was so scared, why did you pull me over? I'm going the speed limit. And he asked me, why are you in this area? Why are you in this neighborhood? I'm a pastry chef. I start work early. Okay, so he got my information and he went to the back of his vehicle. He sat in his vehicle for like 5-10 minutes. I'm getting late to work. I opened my door. He started yelling at me, get back in the car. So I closed the door. He looked and saw I was clean. I had no tickets. I had nothing on me, but he still kept sitting in his car. And finally he came in his car, tossed me my stuff and told me to go to work and left. And I remember sitting there I was so scared. I've been pulled over for no reason.
You were innocent.
I was innocent. But again, baby, I stayed calm. Don't get upset, don't get sassy. Why did you pull me over? Just follow instructions and stay calm.
Okay.
Why would a police officer assume that you did something bad?
Maybe because of my skin color.
Is there anything wrong with your skin color?
No, people make assumptions about people. Some people are bad.
Just because of their skin color?
Maybe there are racist people out here, out in the world.
There is.
Who make assumptions about you that aren't even true.
Yeah. It's about teaching our children, again, what to do and what not to do when a police officer stops you.
Do you ever fear for your daughter's life?
I do. She's coming at the age where she wants to go to the mall and she wants to go to the movies with friends. That scares me. You're supposed to celebrate this time in your child's life. Sometimes I'm scared when she's not with me, because when she's with me, I can protect her. Because of the world that we live in now, there's some things that you're supposed to be excited about I'm not excited about. I'm scared.
I didn't know that.
If you're at the
Powerful stuff. And if you do have or encourage a family to have a talk about racism with their kids in a session, get a whole pack of tissues, folks, because folks get very emotional about it. But it's very important for us to understand the strengths of family in African American culture. We are an extended family culture. Read the books, that's why we write them. Even if your Black client is a single adult, man or woman, they may express concerns about these racist incidents and feel fears for their nieces and nephews and grandnieces and grandnephews. Individual therapy for Black people can often become family therapy with one person. I talk about that also extensively in Black families in therapy and in adolescents at risk. It's very important when you see a child in therapy to not only meet with the child, with the person who brings them, but to do a cultural genogram to find out who else is in the family and to invite others in, because they can be a part of this discussion. Now, I mentioned earlier the healthy cultural suspicion that many African Americans bring to therapy. That is a result of anger at racism, racial trauma, which adds to that healthy cultural suspicion. As a therapist, do not take it personally. It is not about you. It is about the experiences that client or family has had with racism. And it's a suspicion, remember, of institutions, including our clinics, schools, hospitals. Many African Americans may initially be concerned about working with a counselor or a therapist of a different culture. Therapists of all backgrounds must take the time to join and connect on a human level with Black clients before doing our intake forms or assessments or proceeding straight ahead into treatment. Many of you, I hope, were able to see Harry Aponte last month. Harry taught us all about the use of self, the therapist or the counselor's use of self, and establishing therapeutic rapport with our clients, building trust, joining past that healthy cultural suspicion. And it's essential in cross-racial and cross-cultural treatment. Now, I want to spend a little bit of time coming back to this issue of addressing race, racism, and racial trauma in therapy with African American clients. Clinicians need ongoing training to get past the fear of raising these racial issues in therapy. Elizabeth McCorvey has written a wonderful piece that actually went viral on the internet in 2020. I've included the link in my references for you. She gives a number of examples of ways in which to open up the discussion of race or racial trauma or racism in therapy, particularly when a racist incident like the killing of George Floyd occurred. And she gives the example, client comes in to therapy and has not mentioned anything about the fact that the killing of George Floyd is all over the news. And in some cases, she has raised with a Black client, I've been thinking about you lately with everything that's been going on since the killing of George Floyd and all the Black Lives demonstrations since then. And I've been wondering how you've been feeling. And then pause, just wait for a response. And I've been thinking about the racial trauma that you might be experiencing. What's this been like for you? And you may want to you want to sit with it, be with it, and allow your client to tell you or not tell you. They may tell you that they don't want to talk about it. And you want to sit, as McCorvey says, with your own discomfort and let your client know that they can feel free to bring it up at any time if they would like to talk about any of these issues in the future. Pretty powerful stuff. Now, back to that slide we looked at earlier. So it may be very important when a client shares this experience to really validate them, to understand, to really go after the deeper feelings that they may have been feeling. And then in a future session to go back to it and to let people know that you've been thinking about them and what it might have been like for them to share it with you. In a later session, you might even ask, have you ever experienced racism in your life? Or even a time when someone said something because of your race that was offensive to you. Very important issue. Now, be prepared for possible expressions of anger when you do ask. That is very important. Be prepared for emotional reactions. Do not rush through this process. Be there with the feelings and allow your client, help your client to express them. Now, for white therapists and clinicians from other ethnic and racial groups, it's very important to seek out specific training on these issues regularly. Once is not enough. Consult with African American colleagues to understand these racial and racial trauma dynamics. Be able to address the anger of Black clients. Do not take it personally. Don't be afraid of it. Because of experiences with racism, many African American clients may be hesitant about cross-racial treatment. And it is up to us to join past that. Now, it's very important. I know with students, I always go back to this. Do not show off cultural competency or cultural knowledge. Ask the client. And pursue experiences outside of therapy to explore your own life experiences, cultures, and biases, or in your own therapy. Form support groups or peer supervision groups that include Black colleagues. Now, for Black therapists, I want to really underscore something, Black therapists of all backgrounds. For many Black therapists, hearing Black clients talk about their experiences of racism and racial trauma can be very triggering for us and can result in vicarious trauma. Now, this is very important for supervisors working with student therapists or for early career Black professionals. Many Black therapists have formed their own support groups or peer supervision groups. I have been blessed in my own life with a number of sister friends in the field, and we contact each other regularly to talk about these experiences and to get input. The most important thing as a therapist when you're dealing with these issues is do not be alone. Isolation is deadly. And I want to share some other suggestions for therapists that come from a wonderful presentation given by one of my former students, Dr. Jennifer Jones-Damas, who has talked about assuming that every racially diverse individual, group, family, or community has strengths and looking for these strengths, asking about family, asking about the strengths. Consider the historic resilience of ethnic minority persons. Talk with them about survival skills. How have you survived? How have you overcome traumatic experiences in the past? How have you or your family members dealt with racism in the past? Now, some of the challenges for therapists that Dr. Jones-Damas has talked about is you may risk re-traumatizing your client by ignoring or not recognizing their perception of racism and their experience of racial trauma. Do not debate whether or not racism was involved. Try to understand the client's perspective and allow clients the space to experience their anger at racism or racial trauma. They may express anger at those who've hurt them. And again, try not to take that anger personally. It's not about you. Now, I want to encourage you to also go back and do reading about cultural strengths. all of my books. I've written 7 books. They're all about cultural strengths to promote resilience against racism. Again, not just discussing them with your clients, but also early in therapy, asking about their own cultural and racial backgrounds and how they identify racial and culturally, validating their strengths, labeling them, the strength of family. Also, I have loved writing about spirituality and religion. You might want to ask, some Black clients have talked about using spirituality or religion to survive against racism. Has that been a part of your life? And we'll talk about that a little bit later, because that is huge in Black families. An amazing reframe that I use all the time with Black clients is, you are a survivor. And in response to racism, if you're walking, talking, and breathing, and you're a Black person, you are a survivor. Spirituality and religion are strengths in Black families. They are an antidote to racism and racial trauma. Remember that Ken Hardy calls racism and racial trauma soul wounds. So healing racial trauma often involves spirituality or religion. Black people throughout the world have used their spirituality to heal the soul wounds of racism and racial trauma. Diverse, but there's a total diversity of religious and spiritual practice. Some Black people are Christians. They may be Baptists, AME, African Methodist Episcopal, Church of God in Christ, Catholic, Anglican, or Muslim, or other religions, including African religions. But some Black people are not the least bit religious or spiritual. And one needs to realize that you will encounter Black people who are not. Now, in my own life and in the lives of many that I know, messages of protection are very important. Things from the Bible, like no weapon formed against you shall prosper, and every tongue that rise up in judgment thou shalt condemn. And messages like, you are never alone. God will never leave you nor forsake you. Black people love quoting these things. So ask your clients about their spirituality or religion. But I want to just end by talking briefly about the issue of making a difference for our clients by raising these issues of racism or racial trauma. Many of us become therapists out of our concerns for social justice. And we sometimes feel like we have to do something big to fight racism. Protests and social justice advocacy can be very powerful. But in addition to that, don't forget that you can make a difference for each Black client whom you work with who has experienced racism or racial trauma. You can empower them to hold on to their racial identity, their strengths, and their resilience that they have shown by surviving. And I just want to end on, those of you who know me, this is my favorite story. It was very much what sustained us through the AIDS epidemic in the early years when so many people were dying. There are many versions of this. You can go on YouTube and get them. But my version of the starfish story, man was walking along a beach and there were starfish everywhere. Now, in true confession, I must disclose that I was born in Harlem and raised in the Bronx, so they had to translate this story for me. But he sees a little girl up ahead throwing starfish back in the water. And he goes up to her and asks, "What are you doing?" And she says, "I'm throwing starfish back in the water so they won't die." And he says, what difference does it make? There are dozens of starfish on the beach. That little girl picked up the starfish, threw it in the water, put her hands on her hips and said, it made a difference to that one. And I hope you will hold on to this memory and remember that you can make a tremendous difference for your African-American clients if you are willing to discuss these issues of race, racism, and racial trauma in therapy. Thank you very much. And now I'm going to ask Marlene if she would like to raise some questions that you put in the Q&A.
Yes, I will do that. Before I do that, I want to acknowledge the chat and the differing opinions that have occurred in the chat. It has been difficult for some people to really stay focused on this topic about race. And if it's difficult for you to even listen to a talk about race, then I think there's much work that we need to do as therapists to be able to effectively work with our Black clients. So I just want you to know that it is not being ignored, but it is not going to distract from what we came here to do tonight. So thank you to those of you who really wanted to hear and listen to Nancy's talk. And for those of you who were triggered by it, I dare say that I would encourage you to think about, if you have Black clients, what you may be demonstrating to them, whether you intend to or not. So with that, I'll go to questions. Shauna, can you, or Nancy, do you want to take your slide down now? Sure. Stop your PowerPoint.
Sure.
Okay, we have one question. First, there's a thank you for your presentation. And would you share a few thoughts on the APA's recent apology to people of color for APA's role in promoting, perpetuating, and failing to challenge racism, racial discrimination, and human hierarchy in the US?
Yes, it's about time.
Not much else to say, huh?
No, I think it's time. And so many of our institutions have created this discrepancy between what we say and what we do in terms of race and racism. And I think it's important that we acknowledge that that has occurred.
Yes, thank you. Then we have a question. I found that some clients deny experiencing racism. However, when they discuss stressful incidents, the clients who I have asked about racism often provide specific examples that we then explore further. Should I point out that these incidents can be considered racism so they can name it?
It depends on your client, all right? And I know that's a wide answer to your question, but it's very important early in therapy to learn a little about your client and their background, all right? The reason I asked you to consider that this talk would be about African-American clients, there are many Black clients who are not African-American and who don't respond in the same way to the word racism. And that's very, very important. And you may not know that about your client unless you ask, all right? Your client may not have an accent, but your client may be raised by parents who were from another country, who did not have the same experience with racism that many African Americans have had, all right? And so it's very important. In some cases, you might introduce the issue of race or racism, but you also need to know a lot about your client before you plunge in. And the more we ask, the more open we are, the more we can address it as we move along.
Okay, thank you. Okay, I am a white therapist. How would I approach a conversation with a Black Muslim client on their racial trauma? Should I address it or allow them to address it on their own terms?
I think you need to first talk with that client about their experience. And I hope I've said this 900 times by now, but it's so important to take the time to find out what the person's own experience has been, how they identify racially and culturally and religiously, and to explore with them what has this been like for them, right? If you discover that they were born in this country, what was it like? Did they grow up Muslim? What was that like for them? Did their experience change after 9/11? Have they experienced additional isms related to Islamophobia, right? So they may process those experiences differently. And it's very important to get a sense of where your client is coming from, because that experience may be labeled by them very differently. I hope that helps. By the way, I would strongly recommend that you take a look at Monica McGoldrick's book, Ethnicity and Family Therapy, because a number of other religious groups, including Muslim groups and African, Haitian, Caribbean groups are all discussed in that volume.
Okay, the next question is, people who are new to doing this work are likely to feel and be a little clumsy. I wonder how you would advise people how to engage their clumsiness.
McCorvey is great. Elizabeth McCorvey's, it's only a couple pages, and I've given you the link in the PowerPoint slides. But she describes saying, you know, just I may be clumsy in asking this, but I'm really concerned for you. And I heard what you just said about your experience with that comment that was made to you. And I was very moved by that experience. And I wonder if you've considered if that experience might be related to racism. And open up the dialogue. That client, depending on their background, may not see it that way. Therapy is not a conversion process, folks. It's an opportunity for people to express what they are feeling. Thank you. That was a very good question.
Okay. You discussed a possible session where it is important for us as the therapist to process the client's thoughts, emotions before the session. Would it be considered a microaggression if the therapist attempts to fill that space with their own experience? I fear perpetuating that cycle indirectly or on a subconscious level.
I think that's another very good question. It is not our job to share our experiences. It's our job to create a safe space for our client to share theirs. Now, having said that, if you are of the same racial or cultural background as the client, and you feel comfortable sharing something that you think will validate that client, that might be an exception. But therapy is not the place for us to work through our issues. It's the place to create a safe space for clients to work through theirs. I hope that's helpful to people.
Okay, thank you. When working with families with adolescents, I sometimes notice parents dismissing their sons' experiences of racism, mainly by police and schools, because it's nothing compared to the old days. Any tips for this? I guess time with the parent to process their own experience first.
Yes, absolutely. That's why I mentioned it. Marlene and I were talking about young people who are in the film industry a little earlier, and my youngest son is a writer in LA, in Hollywood, and he sent me a clip from Grey's Anatomy in which a family just went ballistic trying to explain this to their child. And I sat there thinking that if that were in a session, that it might have been really helpful to help those parents process their own feelings first before they went in there. I don't know if we have time, but Marlene, if it's okay, I'll just tell them a quick story.
Sure.
My oldest son, my stepson, Tunde, was in one of the top schools in New York, in Brooklyn Tech, when he was in high school. And he and his boys were all on the football team. And they used to come and hang out in my house. These kids went off to college and our food bill went down by hundreds of dollars a month because these guys could eat. And one day I'm in the kitchen cooking and it gets very quiet in my living room. Now, any Black parent worth their salt knows that if a group of Black adolescents suddenly gets quiet, something's up. So I go in the living room and I almost dropped dead on the spot. These guys were getting ready to leave my house and they were tossing around what was a very realistic looking Black water gun. Now, I have to confess, my years of family therapy training, my years of training as a psychologist went right out the window. And I had to tell these big Black men what happens if they go out on the streets of Brooklyn running around with what looks like a realistic looking Black gun. Mm-hmm. And that emotion, I can guarantee you that if I were in therapy with my family, I would need to process that before I have that discussion with my kids.
Absolutely.
Hope it helps.
Okay. Do you have any suggestions on repairing a rupture after a racial microaggression or slight from a therapist?
Yes. Say you're sorry. I mean, I think it's very important to say, to be honest, to say, you know, I just realized as I was listening to you that what I said to you may have been really hurtful to you. Is that true? And I want to let you know that I apologize from the bottom of my heart for that. But I think we need to talk about it. What did that make you feel? You know, we're trained to do this around other ruptures and repairs, but not around race. There is a marvelous dissertation by one of my grads, Mercedes Okosi, O-K-O-S-I. It's on microaggressions in therapy. And you can obtain it from Rutgers University, but it is incredible. Some of the things persons of color have experienced in therapy with therapists.
I'm sure. What would you recommend for Black clients experiencing workplace bullying?
Yeah, there's an article that AJ and I actually wrote, my husband and I actually wrote in the Journal of Emotional Trauma in 2006, that really talks about this issue of workplace bullying in our field. Because remember, many Black people in clinics and hospitals and universities across this country experience workplace bullying, and what one of my students is studying in her dissertation, racial battle fatigue. Okay. One of the things that I found tremendously helpful, I started, and my husband started, and many of my colleagues started, groups in our practices for Black men and Black women, so that they could have a place where they could talk to somebody about racial bullying that they were experiencing. Right? In my book, Therapy in the Real World, there is a whole segment on that in terms of experiences that are demoralizing for therapists. And I hope that you'll take a look at it. 6 of my 7 books are with Guilford Press, so I would suggest you go to the Guilford website. And the additional book, Boys into Men, Raising Our African-American Teenage Sons, is on Amazon.
Okay, just so you know, everyone, we are planning, when we send out the link for the recording, to also provide some links to the books.
Ah, wonderful.
Yes, yes. Thanks to Shauna.
Our hats are off to Shauna. Those of you who are doing Zoom videos and teaching classes on Zoom, or seeing clients on various virtual venues, know that we are so grateful to those of our younger generation who are marvelous with this technology. So thank you, Shauna.
Yes. This one says, thank you for a great presentation. I was wondering if you can speak about intersectionality as it relates to racism and sexism. As an African-American woman who has dealt with white males in many different situations, I often wonder how to differentiate and address either or both.
Well, the is and the isms tend to cluster. So I have to confess, I don't waste my time much trying to figure out which is which. I find that it is very important that you have the opportunity to talk to people who are Black or other people of color who have gone through the same thing. I'm positive that I would not have gotten that kind of question from that graduate student in his journal if I had not been a Black woman. That microaggression was still incredibly powerful. And so I did not waste time trying to figure out or parse out the specifics. From my point of view, intersectionality tells us that you can be privileged in one area and oppressed in another. You can be oppressed in many areas of your life. And so I think it is extremely important that we call out oppression when it occurs. And it's not our job to piece out which particular oppression is operating at that particular moment. But I want to thank you for that question because it comes up a lot. And for those of my generation, the experience of racism, not only from white men, but sometimes from white women, was very painful. And that can often occur. Someone asked earlier about microaggressions and bullying in the workplace. That is huge. But definitely go on Google Scholar and Google Franklin, Boyd Franklin, and Kelly, 2006, and look at the issue of how these issues come up for Black people in other areas of their lives.
Okay. Thank you.
Boy, these questions are fabulous, everybody.
Have you used community-based interventions to address racial trauma?
Absolutely. Folks, I wrote a book many years ago with Brenna Bree. It was called Reaching Out in Family Therapy. And it has a whole chapter on community-based interventions. We were starting a community-based program in a community in New Jersey, and 14 Black kids were arrested in a middle school. These were 12 to 14-year-olds for what they called rioting. And we developed a community-based intervention that addressed that. I think the future of treatment around these kinds of issues like racial trauma is definitely, we have to consider group and community interventions.
Okay. Next question. A white student of mine refused to role play a Black teenager and mentioned cultural appropriation. Any thoughts on this?
Yes, I think that many of our students are so afraid of doing something wrong that they pull away and do nothing. And I think it's our job to help them be able to acknowledge their own limitations, their own experience. I might have asked that student, what did it stir up for you when I asked you to do that role play? And hear them out. Because many times people are afraid. And when they're afraid, they do stuff. They operate out of their fears. And we as supervisors can do a great deal around that.
I agree. Let's see. I don't see any more questions in the question and answer feature. So let me just take a look at the chat to see if we have anyone who may have put one there.
Or you can read some of the comments.
Yes. Just because I'm at this place, Matthew, I'm sorry. There's one that says, Dr. Watson hosting and Dr. Boyd Franklin presentation and wisdom. You and your lifelong work are very much appreciated and deeply valued. So that's one.
Thank you.
See.
We have something that just flashed on the chat that went by so quickly. I wasn't able to read it.
Oh, just now?
Mm-hmm.
What would you recommend? The last chat is, what would you recommend in terms of working with Black families surrounding the trauma of COVID-19?
Yes, thank you. Oh, That is a marvelous question. Folks, critical race theory. I remember fondly Derek Bell and some of the early law school folk who really began putting that out, argue that there are disparities. Institutional racism is alive and well in this country, and it is eating away at the lives of Black people. And COVID exposed the racism pandemic. It is no accident that large numbers of Black people were dying of COVID. It is no accident that large numbers of Black people were in the group that had to go out of their houses every day and risk their families and their lives in order to keep jobs that they needed to survive, right? And so I see COVID as ripping the curtain, pulling the curtain back on the issue of institutional racism and really displaying the disparities. In the Black community, we are scared to death that our kids have lost a whole generation of school because many of them did not have the technology, they did not have the equipment, they did not have somebody at home who knew what the teacher was talking about to help them through this time. And so absolutely, that is a powerful question. I'm glad we went back and found it. Absolutely, that is what has contributed. Those disparities have always existed in this country, but COVID ripped the scab off and ripped the curtain off the issue of the racism pandemic.
Indeed it did.
Oh, and one other thing, every Black person that I know personally knows at least someone personally who died of COVID. In 2020 alone, my church, it's a Baptist church, lost 300 people to COVID, just one church. I have been to so many COVID-related funerals that each one is a re-traumatizing experience. And that experience in the Black community is a collective racial trauma.
Yes. I'll read some of the comments since we have a few minutes left. Thank you so much for the role playing and modeling pieces of important conversations. Thank you, Dr. Boyd Franklin, for sharing all your wisdom with us. It is always an honor to hear you present. Thank you. This was an amazing presentation, very thought-provoking and informative and helpful. Thank you for your wisdom and insight. Very much appreciate the honesty and great modeling of specific ways to address these issues. Microaggressions also occur from people of color. I grew up hearing this from my Latina fellow community.
That's a very good point. Absolutely.
Yes. And I'm going to add one of my own. It's also from my perspective, and I'm speaking purely for me, that it's a microaggression when we talk about race and suddenly the conversation is derailed to gender or to some other group who has experienced oppression. I think it's dishonoring and that it acts as a wound as well. And so it's an assault also. So that's me adding.
That's very powerful, Marlene, because I think that can be an aspect of a workplace microaggression too.
Yeah.
And it's something in this field, in these professions that we need to be aware of, because we all have our unconscious biases and they come out. It's very important that many of us do not really experience people from other cultures. We sort of rub shoulders with them in the workplace, but then we have a totally different life. And I think it's very important that our therapists and supervisors who are white get to know Black people and other persons of color on a personal level. Because if our clients are the only ones we get to know on a personal level, then we haven't had that opportunity to talk about these issues in situations where we can have a two-way conversation.
Absolutely. And I'm going to end with this comment, which echoes my thoughts about your presentation. Awesome and inspirational presentation. So thank you, Dr. Boyd Franklin. Nancy, I appreciate your coming to talk about this very important and critical issue. And I hope that people will take it to heart so that we can do the work of really, helping Black clients to have an experience in therapy that they deserve.
Thank you so much for inviting me. Everyone, good luck. There is so much more written about this now. I really encourage you to look at Ken Hardy's work. It is incredible. Be safe, be well, and be blessed.
Oh, thank you so much. And good night to everyone. Thank you for joining us. And we hope you will join us on December 10th for Dr. Kenneth Hardy. So good night, everyone. Have a great weekend. Bye, Nancy.
Good night, everybody. Bye.